Hello everyone, I am Dr. Yousef. I am a cardiac surgeon at Apollo Hospitals in Chennai. Cardiac surgery has evolved since the 1970s from open procedures to beating heart procedures to minimal invasive, which is small cuts on the sides of the chest, to now performing the same with much smaller cuts using the robot. So prior to robot with minimal invasive, as you had asked, we were using camera, which was 2-dimension, and then yes, of course, it's moved to 3-dimension. The major advantage of using the robotic system in cardiac surgery is the two major factors. One, the dexterity. The robotic arms are tiny, less than my little finger, and they move 360 degrees. The company says 500 degrees, so it's all around. And we can utilize the arms by the surgeon operating with both arms. So it gives dexterity to the surgeon and the robotic arms as well. That is one big advantage. The second big advantage is visualization. The visualization can be magnified 20 to 40 times. So literally the camera can go into any part of the heart. So these two are the big advantages. So actually cardiac specialty was the last to. Initially Robo was introduced for cardiac surgery but faded away in late 90s. But now coming back, this is one of the last few specialties to take up robotic surgery again. And in the last decade, there's been huge progress. India has contributed a lot over the last 5 years to this progress, where the companies itself are looking at cardiac surgery to make certain instruments to promote cardiac surgery, because that's one specialty where the patient really benefits. We can avoid the full big cut in the sternum. There's no splitting of the chest, which is the biggest morbidity and fear for most patients. So in future, currently, as I said, we are doing bypass surgeries, valve surgeries, even transplant surgeries are starting to be performed, and major aortic surgeries are performed. And we are working on some devices, anastomotic devices for bypass procedures to enable suturing as well without cutting even the chest. So that way patient's recovery will be quicker, procedures will become shorter, and hospital stay will be a lot less. So this is one step on the bypass side. And on the valve side, again with more experience from the surgeons, it can be much quicker. Telesurgery is the next in line, where surgeons can sit in one place and operate anywhere in the world. This will enable more institutions to be trained, more surgeons to be proctored, and best outcome for patients in a safe manner. So this is one big step in the future for robotic cardiac surgery.